As the son of academics, by the age of 10, I lived in 4 different continents, 5 different countries, and 7 different cities. I went through 8 different education systems. And just my first grade, I did in 4 different countries, spanning from New Zealand to California. And so it's no surprise to you that I developed a real passion for cities, an exceptional passion for cities. And so 4 years ago, I left the corporate sector and I set up my own strategy consulting firm with my partner, who's somewhere out here. And we started working with cities literally all around the world. And we particularly worked with cities that were looking at doing stuff beyond their infrastructure, beyond their systems, cities that were looking to impact their residents, to touch their residents in a small sometimes, but an exceptional way. Because you see, cities are basically all the same. Cities are fundamentally very, very similar. This is one of the tricky things when you're advising cities. They all have the same infrastructure, the same roads, the same parks, the same basic infrastructure. So what is it that makes some cities special? What is it that drives loyalty to some cities? That drives a sense of a connection and a sense of belongingness to a certain city? And what is it that makes some mayors greater than others? And so in order to describe this, we decided for you here today to develop a simple model. In fact, this is probably the world's simplest smart city model. And we made it simple for a simple reason, because it needs to answer one and one only question. What makes a city exceptional? Originally, people came to cities for the safety and the security of city walls. Infrastructure then evolved, roads, public buildings, energy infrastructure, and it all became more and more complicated. Eventually, cities required some systems to manage them, and a second layer was formed. This is our social infrastructure. Our social infrastructure is our health system, our education system, our transportation system. It's our trading system. And these 2 layers, all of this was done in order to support us, the residents, to provide services to us, the residents. But in fact, we're not really part of the process. We're not really part of making decisions in our cities. Because cities are fundamentally about the infrastructure. They're fundamentally infrastructure up. Build it and they will come, right? That's what they say. And so, when we were traveling around the world, talking to cities in many different places, we noticed that some cities do something different. Exceptional cities do something different. Exceptional cities break this norm. Let me give you an example. Paris. August. Now, August is a really rough month for Parisians. Temperatures are soaring, businesses are shutting down, and residents are leaving for the coast. Now, the mayor of Paris, he knew this. And he also knew that the residents that stayed in town, they suffered from something that we've coined Parisian depression. Now, mayors are really good with changing infrastructure stuff, but they're not really capable of dealing with things like mood swings of their communities. This was a challenge for him. But he had a brilliant insight. And his insight was that if people from his community left the coast, they went to the beach, then maybe if he would bring the coast to the city, maybe if he would bring the beach to the city, it would fix his problem. In fact, he did exactly this. He brought 5,000 tons of sand from the Riviera to the center of Paris and 100 palm trees. And he created a virtual beach in the middle of the city. Now, I thought this was a great story, and I told my daughter this story, and when I told her the story, she looked me straight in the eye, and she said to me, "Dad, this guy is a great mayor." Now, I don't know how many of you have 12-year-old children, but I can tell you that 12-year-old children don't usually get excited by policy decisions, right? And so what made his decision exceptional? What made it great? In fact, what made it great was that he asked the right question. How do you change the mood of my community? It was a good question. And by asking this question, he shifted his focus from the normal focus of dealing with infrastructure to a resident-centric focus. He was thinking about the residents instead of about the infrastructure. And by making this simple switch, he made his decision exceptional. He made the project exceptional. And to my daughter, he made himself a great mayor. Okay, so Parisians are lying on their fake beach, enjoying the sun. But what about some of the really big issues? What about big issues like pollution, for example? Do the same rules apply for pollution? And so, as someone who's dealt with public policy for many years, when I think about changing pollution, I think about things like 20-20-20 by 2020. Meaning 20% decrease in CO2 emissions, 20% increase in renewables, and 20% increase in energy efficiency by 2020. But fundamentally, 20-20-20 by 2020 is an infrastructure decision. It's a bottom-up decision. It's great for state governments. It's great for federal governments, for the US, for the EU, for China. But what does the mayor of this city need to do for his residents? This is Louisville in Kentucky. In fact, when I sent this image to the designer that I've been working with, she said to me, "No way is this image going into the presentation. Resolution's not good enough. The image is not good enough." And I said to her, the problem isn't with the quality of the image. The problem is with the quality of the air. Because Louisville is one of the most polluted cities in its area. In fact, it's one of the top 20 most challenging cities to live in with asthma. And the mayor of Louisville knew this. And when he knew this, he asked a brilliant question. How do I improve the quality of life for people in my community living with asthma? Now, just by asking this question, he was well on his way to success. But he also knew that he needed more information. And so he decided to deploy sensor-equipped inhalers across his community with asthma sufferers. And he deployed them in order to capture lots of data about the location, about the time of attacks, about the severity of the attacks based on the number of pumps. And the data they started getting was extraordinary. They got 1.2 million environmental data points, and they added an additional 5.4 million data points of other information in order to correlate with it. And they started learning about what asthma looks like in the community. And the correlations were interesting because they realized that when temperatures rose, people were getting more attacks. They realized that along main transportation corridors, people were getting more attacks. And you can imagine that on hot days along transportation corridors, those were the red zones. That's when people got bad attacks. And so here they started making decisions. They said along these routes, these brown routes, where asthma risk is highest, we're diverting all the trucks away. We're rezoning industrial sites away from these areas because we have the information. They looked at the data more and they realized that the worst hit areas of asthma didn't have any trees in them. They started deploying trees in these areas. This data is amazing, but the results are even more amazing. They managed to reduce 82% of asthma rescue inhaler use, amongst other benefits to their community. It was an exceptional result. Let's think about these two examples because we think about Paris and we think about Louisville. In Paris, the mayor looked at the emotional needs of his residents. In Louisville, about the physical needs. These are the new building blocks of our smart cities. These are the new building blocks of our society. Because if we start asking the right questions, we'll start looking at our cities. We'll start looking at our journeys, at our well-being, at our knowledge. We start personalizing our cities because currently our journeys, they're exhausted. Our infrastructure is exhausted. As a mayor, what do you do here? What are your options? How do you create bike lanes? How do you create pedestrian access? How do you fix parking? These are the wrong questions. We should be asking ourselves different questions. Why is everyone going to the center of town at the same time? And what about our well-being? Our social infrastructure is also exhausted. In fact, we know that adding beds to hospitals, we know that adding hospital wings won't help. Look at what they did in Louisville. Look at who fixed the well-being of Louisville. It was the Parks Department, the Transportation Department, the Zoning Department, working together with health and private companies. If we ask the right questions, we can get our city working together in order to solve our problems. Albert Einstein once said that any fool can give you answers, but it takes a genius to ask the right questions. I believe that if we ask the right questions, that the right answers will rise, and we might just turn the exceptional into our everyday normal. Thank you very much. Thank you.